My name is Big Cat Stevens. For me, one of the biggest things as a kid is going to the local pool. But I was always that kid who would never take his shirt off. And even when I lost the weight, didn't want to take my shirt off. You know, for me, that was always one of the biggest deals. Lost a lot of weight. You know, I started lifting and getting in the best shape of my life. But I still had that issue of the midsection. It was just, there's no exercise in the world that I could do to get rid of my stomach. The skin was loose and just kind of hanging. I'm like, all right, this time I'm gonna go do it. You know, I've seen and consulted with other plastic surgeons in my life before, but as soon as you walk into Hunstad Kortesis, you know you're in the right spot.
My name is Liz Mazzoni, and I am a compliance consultant. And I first came to the practice March of 2013. I had twins for my first pregnancy. So I tried for 2 years through diet and exercise to try and pull all those muscles back together, tighten the skin, but there's just some things that don't change on their own. I had noticed that slowly but surely I had cut myself out of my children's pictures. I didn't want to be photographed. I didn't, feel great about myself, and I knew I needed help, and I started with them.
My name is Jordan. I'm the patient care coordinator. I do really get to walk the patient through their journey here at the Hunstad Kortesis Center. When they first come in, they're always very nervous.
I was nervous, but very much looking forward to the results and just trying to get back to how I used to be, how I remembered myself. As soon as I went into the office, I felt really at ease. I love the environment, I love the doctors, I just felt at home. I first had a tummy tuck done, and then I had a breast lift and augmentation done. I didn't have them done together. It was painful, but very much worth it. I don't think that you can put a price on getting that part of your life back and feeling like yourself again. That is my youngest son, Mace, and he was probably about a year old. It was baggier jeans and dark colors again, and just very hesitant to be in any pictures. I can't cut myself out of my children's lives. I want them to remember me, and that just made me feel like I could do that again. Now I want them to see that I'm happy, to see that I'm confident, and to have that roll into their lives. I want them to be happy and confident.
This is the best thing that you can do for yourself. We work in life to earn money, to buy a house, a place to live, but we rarely stop and think about ourselves. A month or two after surgery, I can remember sitting out on my back deck, cup of coffee, just kind of relaxing in the early morning, and then I realized I wasn't wearing a shirt. It was one of the coolest feelings I think I've ever felt, is that I'm sitting outside without a shirt on, It's like, it felt great.
And you can tell immediately after surgery, they have so much more confidence, they're happy. A patient called in and told us her story. She had just lost her husband, and she was looking for a way just to make herself feel better and kind of get through the depression. And she is an awesome patient. She ended up having surgery with us, and I think it helped her get through that hard part of her life.
You're gonna know who the right doctor is when you meet them, and then I think it all falls into place after that. I felt when I came in here, the decision was already made for me. I knew that I had found the right place. When I met the doctors, I knew these were my doctors. I think that you can go to other practices and you can see other doctors and interact with other staffs, but they're where it's at.
They get kind of sad when they don't have to come back to see us every day.
Everything is top-notch, next level. Hunstad Kortesis is the place. I like coming here just to hang out.
We basically leave with a hug, and you have my cell phone number. If you need anything, call me direct. I don't have any other doctors' cell phone numbers in my phone. I have theirs. So that, I think, goes a long way.